School mental health crisis. Federal cuts put students, staff at risk. The recent cuts to federal grants are jeopardizing essential mental health resources in schools, raising significant concerns among staff and educators. As the new academic year approaches, many public school districts are grappling with the implications of reduced funding, particularly for mental health counselors and social workers. This situation has prompted alarm bells to ring across various states, highlighting the urgent need for support in this critical area. Take, for instance, Andrea Tarsi, a dedicated mental health professional working in a rural district in Northwest Connecticut. She is one of 19 staff members responsible for providing support to approximately 6,500 students. Unfortunately, her position is now at risk. Tarsi emphasizes the dire consequences of losing such support, stating, "Without that support staff in the building, students are unable to get the mental health services that they need." And when it comes to crises, not having proper staffing in the building is a safety issue for everybody. This statement underscores the vital role that mental health professionals play in ensuring student safety and well-being. In a controversial move earlier this year, the Trump administration abruptly halted millions of dollars in mental health grants, citing concerns over diversity, equity, and inclusion. The Department of Education claimed that some grant recipients were using the funds to implement race-based initiatives such as recruiting quotas. This decision has left many districts scrambling for resources, as Jonathan Costa, the executive director of Ed Advance, which serves 31 school districts in Connecticut, points out. He expressed his disbelief at the grant suspension, stating, "We hired the best we could find, and I don't even know how to say that. I mean, we didn't hire any counselor of color." Costa further elaborates on the challenges faced by small public school districts, noting that without a full-time counselor or social worker, students have no choice but to seek help from private providers, which are often scarce. A recent analysis by CBS News revealed a troubling nationwide shortage of child mental health professionals, with 47 out of 50 states failing to meet the recommended counselor-to-student ratios, particularly in rural areas. In response to the funding cuts, Department of Education spokesperson Maddie Biederman stated that the department plans to recompete and provide continuation awards, indicating that applications will be reviewed based on detailed plans to address the unique mental health needs of communities. However, Costa is concerned that his district will have to reapply and compete against other applicants once again. This situation is further complicated by ongoing lawsuits from 16 states, including Connecticut, challenging the cuts. The potential loss of the grant could mean that all 19 mental health staff members hired by Costa may face termination. This predicament is not unique to his district. Many schools across the nation are experiencing similar challenges. Costa poignantly remarks, "People deal with trauma in their lives, and when that happens, they need someone to talk to. They need support. And I see every day how our adults help these kids in those situations." This statement highlights the critical need for mental health resources in schools and raises important questions about the future of student support in the face of funding cuts. What do you think about the impact of these federal grant cuts on mental health resources in schools? Do you believe that the focus on diversity, equity, and inclusion should take precedence over funding for mental health services? Share your thoughts in the comments below.